Hello, everyone. This is RJ, and I wanted to welcome you joining us on this webinar as we are preparing for a possible reopening. And today I wanted to invite Jessica Flinchum, who is a worshiper who comes to us, but also an ER doctor at Carillion. I wanted to recall the first time that I first saw Jessica. It was probably, now is it almost a year? She was around
Yeah.
8 months pregnant, and she came in and we got to connect because her grandparents went to the same seminary that I went at Asbury Theological Seminary, and apparently she only lives a block away from me. And I was blessed to see her journey, now becoming a mom of a beautiful Etta, but also carrying out her vocation as an ER doctor, especially during this time of the pandemic. And I thought that inviting Jessica to come and share her experience and seeing what she saw as a frontline worker in the hospital during this pandemic, but also give us some recommendations and tell us what our responsibility should be as a church as we reopen would help for us to safely resume in-person worship. So I wanted to invite Jessica and have her uh, just tell a little bit more about her experience. So Jessica, can you lead us on the way?
Hello. All right. So I'm just going to touch on a few things like RJ said. I first want to talk about kind of the number of cases in Roanoke. So currently at the hospital in Roanoke, we have about 35 people hospitalized with coronavirus, which, to put that in perspective, that's the highest number of admissions that we've had since the pandemic started. And the cases are going up daily, they're going up weekly. In the last 2 weeks, we've had about 270 positive cases of coronavirus in Roanoke. To put that in perspective, 2 weeks before that, we only had 103. So we are increasing. I don't know where we are in terms of the peak of this in this area. I don't think that we are anywhere close because we're seeing this still going up daily. So I have no way of projecting that at this point. It's to the point now that the hospital is about to have to open another unit specific for coronavirus because we're getting so many patients with this. So it is continuing to increase. So with this increase, kind of to segue to things that you can do, I want to talk about a few things: health tips, mask wearing, social distancing, and other things that you can do to help prevent the spread of this. So the number one thing is to wear a mask. To wear a mask when you're out in public, to wear a mask if you're feeling sick. Wearing a mask not only prevents you from getting sick from other people, it prevents you from transmitting anything to anyone else. So the way that coronavirus is spread is through respiratory droplets and from touching your mouth, your nose, your eyes, and then touching other things, shaking hands, touching surfaces. So wearing a mask is one of the main things we can do to prevent that. If you wear a disposable mask, great. If you wear a cloth mask, great. If you wear a cloth one, you want to make sure that you're washing it every day or as frequently as you can. When you wear the mask, the most important thing is not to touch your face. So I know with the mask, they're not comfortable. You want to adjust them. You want to do things. But the most important thing is not to touch your face. If you happen to touch your face, you want to wash your hands immediately. When you're taking your mask off, you want to put it in the safe area or the laundry, wash your hands. If you happen to forget, wash your hands. Lots of hand washing or hand sanitizer. Another thing that's really important with wearing a mask is to wear it properly. The mask does not go down here. The mask needs to go over your nose and your mouth. Wearing it down here doesn't help prevent you from getting the droplets from touching these two areas that are the main spreaders, or from you getting them in those areas. Things that there's a lot of myths out there about masks, that if you wear one, you're going to lower your oxygen levels, you're going to increase your carbon dioxide levels, you're going to get yourself sick. None of these things are true. People in the medical professional have been wearing masks for hours every day with none of these things happening. So please don't think that they're going to cause you to get sick or any ill effects from wearing them. Now, if you have a child less than 2, or you have some sort of respiratory problem where you can't put something over your face, don't wear a mask. But otherwise, you should be able to wear one safely. So the other thing while you want to wear a mask is this virus is contagious before you show symptoms. So you might feel fine, but you may have the virus and you could give it to someone else. In the same instance, if you're around people that don't wear a mask and they have the virus but don't have the symptoms, they could give it to you. So you want to wear a mask to protect yourself and to protect others, even if you don't feel ill. So the most at-risk population is people over 60, people that are immunocompromised, people that have chronic medical conditions, or people that are obese. Now, those are the most at-risk populations. However, we are seeing this now in young, healthy people. We're seeing it in children. It's causing a lot of really weird things that we've never seen with viruses before, like problems with blood clotting issues, problems with neurologic things like strokes. So this is not a normal virus. It's a weird one. So we don't want to think of this like, oh, it's just another flu. This is something that we've seen before. None of us have ever seen a virus like this before. At least I haven't, and nobody that I know of currently in the medical profession has. Unless there's somebody around from 1918, which I doubt it. So a couple of other things, hand washing. So important. You have to wash your hands with warm soap and water for at least 20 seconds. Sing your songs, do whatever you can for that 20 seconds. But we need to do good hand washing at all times. If you don't have access to soap and water, then use a hand sanitizer with at least 60% alcohol content. And do it frequently. Your hands are probably as dry as mine. My hands are peeling. Apparently, that's going to be the normal for coronavirus. Other things that I want to touch on are social distancing. So we say at least 6 feet, and that's a good rule. If you could get more feet in there, please do, because the further you can get away from somebody, the less chance that you have to be close to their respiratory droplets. So this virus can live in the air for about 3 to 4 hours. So if you cough, if you sneeze, if you sing, if you talk, and you happen to spit some of your respiratory droplets, or you sneeze some of your respiratory droplets, it hangs around in the air for a while. If you sneeze, it actually can go multiple feet, like over 20 feet, which is pretty impressive, but a long ways away. So this is why if you can get further away from people, it's better. And this is why you want to wear a mask. Along those same lines, this is why when the church does reopen, there will not be singing. Because the singing, when people get excited and they start praising, things are going to start flying that we don't want to fly, and they're going to hang around in the air. So there will not be any singing, just for kind of health precautions of everybody. A couple of other things that I just wanted to talk about was the testing of the coronavirus. Unfortunately, the tests are not 100%. We don't have a perfect test for hardly any virus or bacteria that we test for, but there's a huge range in how good these tests are. So right now we're seeing about a 20% false negative rate. It's as high as 60%, which means that people are having this virus that aren't testing positive for it. So another way to stress that wearing masks and hand hygiene and social distancing are important, because we don't have a perfect test. And we have people that will show symptoms of the virus and their test will be negative, so they don't think they have it, but they may still have it. So again, mask wearing, social distancing, hand washing. A couple of other things that I just want to talk about in terms of kind of helping each other. Obviously, as a church, we want to help each other. We want to take people food or need, people that need things that can't get out of their house, but we want to do that safely. And so one of the things we want to be aware of with coronavirus is fomites. And what that means is if you touch a surface, this virus can live on that surface. For example, it lives on cardboard for about 24 hours. It lives on plastics for about 72. So if you take something to someone, you want to make sure you set it on the porch. You don't want to be close to them. You want to have your mask on. You want to make sure you wash your hands prior to doing anything with that delivery. When you receive that delivery, depending on what it is, if it can stay on the porch for 24 hours, great. If it needs to come in, then you want to make sure if you have gloves, you wear those. If you don't, then as soon as you get that package in and remove the outside packaging, you do hand washing before you do anything else. If that package touched a surface, you want to clean that with bleach solution or some sort of cleaning solution. So you want to make sure that you're doing a very vigilant process of receiving anything into your home. And this is the same for if you get takeout or you get groceries or you get anything that comes from other people that have touched it. You want to have this process in place to keep yourself as safe as possible, or whoever you're taking the stuff to. So symptoms of coronavirus, as you've probably heard, are fever, chills, nausea, vomiting, diarrhea, loss of taste, loss of smell, headaches, sore throat, cough, congestion, body aches, a lot of things. And the list just kind of keeps growing as this kind of continues. If you are having any of those symptoms, you want to make sure that you quarantine yourself or self-isolate yourself, however you want to put it, for at least 2 weeks. And the reason for this is because the virus is contagious for at least 5 days. In some cases, we're seeing for up to 13 days. And so that self-isolation period is very important. So if you have a couple bathrooms in your house or your apartment, and you can use that one and no one else in your family can use it, and one bedroom, if you can quarantine yourself off as best as possible with lots of disinfecting doorknobs and sinks and anything that you're touching, that's the best thing to do. And obviously, you don't want to go out in public. You aren't the person to go out and get things if you can help it, because you don't want to infect other people. So a couple of other things. Do I see an end in sight for this? I don't, to be honest with you. Like I said before, I don't know where the peak is. I don't think we're close to it. We do not have a vaccine. And once we get the vaccine, I don't know if it's going to be effective. We don't know that yet. Are we close to getting what's called herd immunity, which means that enough people in the community have gotten the virus that it allows some people to have some immunity against it? We don't know what that constitutes for this virus yet. And we are nowhere close to having enough people in our community to have had the virus to be anywhere close to that. So with the country opening back up, with people not adhering to social distancing, mask wearing, hand washing, I think we're going to continue seeing cases going up. And with that, we've already seen, explosions of cases in parts of Texas where it started to overwhelm the medical system again. And we don't want that to happen. We don't want to get to the point where we're overwhelming the medical system everywhere, because we don't have enough staff, enough resources, enough safety equipment to take care of this properly if a bunch of people get sick at once. So we talked about when this first happened about flattening the curve, and we still need to try to do that, because if we can prevent a very large explosion of cases, we can better take care of people. So along the same lines of what the church's responsibility is and what they want to do is they want to open safely. We need to have every part of community open safely, but I think mask wearing, hand washing, and social distancing are kind of our new normal. If you do feel like you want to return to church, whenever that does happen, you need to think about your risks. If you have health problems, if you are immunocompromised, if you have other things that are risk factors for this, I would think very seriously if you should be one of those people that returns to church. If not, continue to watch online or do other ways to worship. as the body of Christ, we're called to love our neighbors. And I think in this case, loving our neighbors and taking care of our neighbors is having social responsibility, which means making some sacrifices with wearing masks, not doing what we want to do in the summer, not doing our normal activities as we haven't for months, and really being vigilant about continuing these practices. So, like I said, when the church does reopen, whenever that is, because I think the date may change, it may not, but I know we want to do whatever's best for the community at that time. I would think very seriously about if you should be one of those people that comes back to church. And that's all I have for now.
Thank you. So, Jessica, I'm going to ask you some other questions, some additional questions. But before we do that, I wanted to kind of ask a personal question. How was it like for you to work in the ER? Like I said, front line of this whole pandemic.
Sure.
With your child.
Right. Yeah. So when this first happened, it was very scary because we just didn't know enough about it. I was trying to figure out if I needed to self-isolate from my daughter, how I was going to do that in our house. I had numerous colleagues that moved out of their houses or moved in with other people because they had small children. I made the decision not to do that because I was still nursing my daughter. But it was very, very stressful and daunting. I've developed an entire decontamination regimen. I come in a certain door. I don't wear the same clothes I work in. I shower before I'm able to touch my daughter. I don't wear any of the shoes in my house. None of the things that go into work come into my house. It takes me an extra 30 minutes to think about all of the processes I have to do to go to work. And then at work, I wear goggles, a mask, at times a respirator, at times an N95. And, there's some shifts where I can't take that stuff off. So I don't get breaks. I don't get fluids. I don't get anything for however long the shift is.
Oh my goodness. Thank you once more for all you do.
Absolutely.
Thank you. So just a couple of questions that I had, probably this is more personal for me. For me, whenever I use my mask, I just leave it on the dashboard of my car. Does that work, or should I bring it in and wash it every day?
Is it cloth?
It's cloth.
I mean, for the best practices, you should be washing every day. So I would suggest having a couple cloth ones so you can have, a clean one in rotation and don't have to be doing laundry all the time. But I will say that I do have cloth masks and disposable masks laying around, but to kind of prevent the most infection spread, I would try to wash it as much as possible.
Good. So we'll wash it as much as possible. So now I'm going to go a little bit more to the church. So for our church, we are going to require a mask. We're going to require social distancing. And we did put some hand sanitizers in locations, but we strongly encourage everyone to bring their own hand sanitizers. And by opening, which is projected in 19th, we do not ask anyone who, like you said, who feels vulnerable, immunosuppressed, or any symptoms with that carries with COVID to come. We strongly encourage them. As a matter of fact, we strongly encourage anyone in our church to stay at home and online with us, participate in the online worship, because we had made it possible when we start all the live service being as if you are, when you watch it, you'll be as if you're in the sanctuary. So that's some of the things that we do. But I want to share, ask a little bit more about singing. So can you share a little bit more why we shouldn't sing? Because we also decided not to sing in the sanctuary.
Right. So when you sing,
with our mask, even with our masks on,
right, even with the masks on, it's just a more risky procedure that's going to allow more respiratory droplets to get, around your mask or in the air. So it's a little bit more of a vigorous activity than just talking. And so that's why singing is going to be limited, because by limiting that, hopefully we can limit the amount of respiratory droplets in the air and limit the spread of people's potential germs to each other.
To each other. And also by singing, we can inhale a lot of the air,
Exactly.
more of the air, and that gives you more risk, even though you have a mask, that you might be inhaling droplets that you do not want. So that's something that we're trying not to do. We are still going to have hymns in our service, but we will pre-record those hymns. And when those pre-recorded hymns are played to the congregation in the sanctuary, we're not going to have lyrics because we don't want to tempt them to sing along. But for all the people who are worshiping online in their living room, we ask for you to sing out loud on behalf of us, because the ones
Right.
who are in the sanctuary won't be able to sing. They'll only be able to sing and praise with their hearts. I want to ask one more thing. So for us, we had designated memorial hall for immunosuppressed people. And like I said, if you're immunosuppressed and if you're over a certain age, staying at home is the best thing. But we also know that there's an urge for people to come to a gathering of community. And I do have to say, we do have some birthday parades, and it's really nice to see each other. But would that help to have immunosuppressed people confined in a separate area, or does it not help?
I mean, I think it helps to a degree. Obviously, you're still putting people that are immunocompromised in the same room.
Yes.
So there is still a risk of the people that are most at risk for getting the virus being together. So it's still risky. And
It
if
is
you
risky.
are,
Yes.
so that is something that people are going to have to assess their kind of what they're comfortable with.
Exactly. We're not saying that that's a risk-free area. We're just saying we're trying to lessen
Right.
the degree of risk compared to being in the sanctuary with all ages and all people, maybe having that. But like I had said in the beginning, if you don't feel free or safe, please do not come. Staying at
Right.
home, we will make sure that that happens. Your same experience of opening worship will happen. Participating in worship will happen. So just one more thing about our worship. Can you share why because in our church, we're going to have a different entrance and a different exit. So our goal is for you not to pass by a path that you had already or someone else had already passed. We're trying to do it as much as possible. Can you share why it is important to not have a same entrance and exit, but why is it important to separate those?
Sure. It's important for a few reasons. One would be to control the movement of people, so there's not a risk of two people walking towards each other trying to get in or out the same door. So it helps with the social distancing aspect. Another reason why it's important is because if we enter one way and we exit another way, then if there was any respiratory droplets or germs that got on this entrance, we're not going back through them within that 3 to 4 hour period. We're going out another way. So it's safer to have a one-way route out, so you're not going back through where possible infection could be.
Great. Thank you very much. I'll just add one more thing that actually how long does a virus survive on a surface? You talked about boxes with 24 hours or a week with that?
Right. It depends on the surface. So I don't know like brick and concrete and wood and stuff, but cardboard boxes are 24 hours. It can live up on plastics for 72 hours. So I would say concrete and wood are somewhere in the middle of that. I would say it lives probably the longest on plastics or materials that have kind of a slick surface. So
great. That's the reason why when we reopen, we're only going to have one worship service, because we don't think that we have enough time to clean in between and have another worship service come in. So our worship is going to start whenever we start. It's going to be 9:30. One other thing that we had learned is cloth and hardboard is where the virus sticks the best. So we're removing all our pew cushions removing all our hymnals. We're removing anything that you can touch on the pew. It'll only be the wood. And the wood will be, even though there are some droplets that might fall on the wood, we're hoping that when we come back 24 hours later, our janitor will be sanitizing the sanctuary or any places that people have passed through. So the church is as clean as possible. And I know that we can never make it a perfect environment, but that's what we're doing as a church. Now, this is my final question. And I know that it might not be the way that I want to hear. Our projected date on July of reopening is July 19th. That's 2 weeks away from the day that we're recording. Is that a right date or not?
In my opinion, no. If we wanted to say the most conservative answer, I think it would be smarter to wait, because I still think we're going to be seeing an increase in cases at that point. So from a very conservative standpoint, I would say we should move it back.
And when you're saying increasing, it's really particularly for Roanoke area, right?
Exactly. So we're still continuing to see this rise. We have not plateaued yet. And we're doubling about every 2 weeks. So if we stayed at this rate, we're going to keep climbing pretty quickly. And I mean, maybe in 2 weeks we've slowed down, but based on how it's affected other areas, I don't think that will be the case.
So if we're on track the way that it is, in 2 weeks, it might be the highest peak that we ever had in Roanoke.
Yep.
And looking at 2 weeks being the time right after this weekend, Independence Weekend. Thank you for being honest with me.
Absolutely.
We'll have to make our decision. Like I said,
Right.
it was a projected date. It has never been a solid date. So Jessica, once more, I wanted to thank you for your service.
Absolutely.
And I wanted to share once more that not only me, but our congregation is praying for you and many of the healthcare workers who are
Well,
on the
thank
front
you.
line. Thank you. Thank you once more. Thank you for your time, sharing your expertise for us as a church.
Mm-hmm.
And please continue to give us any tips or guidance as we walk through these uncharted territories.
Sure.
Great. Thank you. Let me close. So everyone, I wanted to just thank you for being patient during this time as we are going through this pandemic. Like we had said, July 19th is our projected date, but it might change. But the most important thing for us is your safety. And is your safety to continue for us to carry out our social responsibilities in this world. We have to love our neighbors. We have to love this world. And in order for us to do that, we need to take responsibility. So continue to do that for us wherever you are, and be safe and healthy. Thank you once more, Jessica, and we will talk again.